Hello. So, as most of you know, the client base served at Full Circle is families from lower socioeconomic statuses and the children that are dealing with behavioral issues stemming from either psychological abnormalities and/or a history of abuse and/or neglect. At Full Circle, we use several evidence-based practice theories, such as strength-based and family-oriented. However, one you may not have heard of is called PracticeWise, which offers a lot of online consultation, tutorials, training, and other informative resources. Um, at Full Circle, we use this mostly when we're setting goals with the families. Additionally, motivational interviewing is a technique used to treat addiction by using a collaborative rather than authoritarian measure, and utilizes open-ended questions and also strength-based interventions, while also using reflective statements. In this case, it was motivational interviewing was implemented by collaborating with the Council of Alcohol and Drug Alcoholism and Drug Addiction, or CADA for short. And this was in Santa Barbara County. So for teens to be in this, they had to be 14 to 18 and have it be a first-time offender for drug or alcohol use. Also, their parents had to be and them had to be okay with completing surveys and being randomized into either a motivational interviewing group called Free Talk or a control group that they refer to as the usual care. So when they were either randomized, they took each group of five were randomized at a ratio of 3 to 2, with 3 in Free Talk group and 2 in the usual care group. Um, and this was done, and the sample was taken between January of 2009 and October of 2011, and there was 275 teens that were screened for the study. Um, so 193 were randomly assigned to either Free Talk or Usual Care. This was also the groups were facilitated using 4 psychology doctorate students at the University of California, Santa Barbara. Um, these facilitators were solely for the motivational interview group. Sorry if I didn't make that clear. The 4 psychology students, and they would do various things during the sessions. For one example, they would discuss the pros and cons of continued alcohol and other drug use versus cutting back on drug use or quitting entirely, and the willingness. And they would also talk about willingness and confidence rules to determine where the teens were at in wanting to change or not change their alcohol and drug use. These facilitators were very supportive of the teams in terms of either wanting to change or not wanting to change. Um, each session lasted 55 minutes, and also uh, each session would be a different one. So another example that something they would do at a session would be talk about the myths around alcohol and drug use. A myth being like, I'm more sociable when I drink, stuff like that. The facilitator would also reflect concerns teens may have about how their personal beliefs may be affecting their subsequent use. Another session discussed the teens' thoughts about the path from no use to experimental use to addiction and how they might change to exit this path if they wanted to. They used, like I said before, a lot of open-ended questions and reflective statements. Um, and this was compared to a more confrontational approach that would utilize abstinence-only treatment and talk about losing control of your body and your mind when talking about drugs. As far as the results go, it ended up being 113 in the Free Talk group and 80 in the Usual Care group. Overall, the results were not super significant. There was a lot more reported, just a lot more reported excellence as far as the groups or how they were run. For the Free Talk group, more of the teens said that Free Talk was better or excellent than the teens in the Usual Care group. Um, Additionally, They did use some short-term follow-ups to see where if there were reductions in alcohol and other drug use and consequences. How and there were in both groups, but they weren't really significant enough to know they were both pretty low. Additionally, they had a 12-month recidivism rates indicated that the group that went through motivational interview may reduce recidivism more than the usual care group. However, they do state that a longer term follow up with other comparisons group is warranted. As far as how I would use this in my practice, open ended questions are great for working with these kids, just because close ended questions, I mean, you're going to get a close ended response, even sometimes if you ask a open ended question, just because kids, especially kids that have suffered abuse or neglect or just rapid changes in their environment from just all sorts of life conditions, drug use, just moving, poverty, I mean, traumatic brain injuries in one of the parents, all sorts of stuff. So it's good to use open-ended questions and very reflective statements just to kind of get a sense of where they're at. Um, Additionally, I liked how they talked about change talk in the motivational interview, and so I hope to use that. Although I do understand that they say it's a delicate subject to talk about, just because change can be scary, especially for these kids who may not fully understand what needs to be changed and why. But yeah, that is my post. Thank you for listening.